Hey, how's it going, everybody? Sarasota Tim here, coming to you from beautiful Boynton Beach, Florida, right here on the beach, public beach in Boynton Beach on a gorgeous, gorgeous day, wintertime, end of January, January 31st. Tomorrow is the beginning of February as we come into the, I guess, the peak of winter as we come into it. I wanted to talk to you guys this morning about Social Security and Medicare. I've made a lot of videos talking about Social Security and my belief and proving in math why you get more money by collecting your Social Security earlier than later. And I've had plenty of testimonies, hundreds, from people that actually didn't even know you could collect Social Security at 62. Believe it or not, there's a lot of people that don't know this. But once they find out they can, most people do want their money sooner than later, especially once they find out that you get 100 grand more that you would have to wait 5 years to get $500 or $600 more money. You'd have to live to 80 years old to even make the money back. But that's not what this video is about. We'll make more of those, believe me. That's not the end of my Social Security videos. I will continue to help people to understand that collecting sooner than later is much better. Even if you don't need the money, invest it or do something. But what I want to address today is the constant question I get from people about what do you do about insurance? What do you do about your coverage on your insurance? Because that's a legitimate concern. And you don't get any insurance when you don't work. If you leave your group policy, and you're too young, if you collect Social Security at 62, to get Medicare, which doesn't start until you're 65. So what do you do for 3 years? Well, folks, I don't pull any punches. I'm just going to tell you what I do. But before I do, because I always hear it in comments where people say, oh, you shouldn't give any advice. You don't know anything. Or people should seek their own thing. I will make this disclaimer, okay? You don't have to be a financial counselor. You don't have to be, I don't have to have a title behind my name that I understand insurance, Medicare, Social Security, anything. I am a recipient. I am an American that receives it, and I've studied it, and I have Medicare now. I'm 65. So I know as much as the next guy. And I'm going to tell you right now, when it comes to being insured, this is something that you should do on your own decision. Disclaimer, you make your own decision, but I'm going to tell you what I did and why I did it. I've been self-employed most of my life. I didn't work for a company that gave me group insurance. I have had group insurance for a very short time when I did work for somebody when I was very young. But I've been working for myself, which is the way to go, because you can make your own money being self-employed, but you don't get insurance. You can buy insurance, you can pay a lot of money for it. But what I discovered is when you do work for somebody and you take out a group policy, that costs you a lot of money too. I know people, I think my daughter and other people have told me they spend $300, $400, $500 a paycheck or a month for their group policy to cover their family. So it isn't cheap. But here's what I did. When I became self-employed, after I didn't have the insurance, I have always been a healthy person. Even when I was married and had my kids and raising the kids, there was nothing anybody ever really needed as far as, cancer and diabetes and other real high medical costs. There was a sore throat, and so you got some antibiotics, and there's really no cure for viruses. You just have to kind of let it get through your system. Now, I'm not saying this because I'm making a broad term that can't happen to people. You have to take a chance. It's a gamble. But here's what I won't gamble. And here's what you're not taking a chance on. If you're 62 and you can start collecting your free check, and that's what I call it. I know it's your money that you paid in. I call it a free check, free money. I get $1,700 a month. And if I stayed working for 3 more years or didn't collect my Social Security until I was 67 for 5 years, that's $100,000 that I would have left on the table. And I can tell you that at 65 years old, I can count the times on one hand how many times I've been to a doctor. And it really wasn't anything that I couldn't have afforded Well, I did afford it because I didn't have insurance. And so they have urgent care today. They have do drop in hospitals, you know, that you don't have to, you pay them $100 to $200 and a doctor comes in, he examines you and he gives you a prescription for something and you're on your way. But yeah, if you have an emergency, you're in a car wreck or, you know, something major comes on you, some bigger diseases, you know, I don't know what to tell you. Here's your choices. You can either stay at your job and keep paying that $300 to $500 group insurance, which is what, $6,000 a year, and how many years have you used it? How many years have you paid for that insurance and really didn't use it for what you spend every month and every year? How many years went by you didn't even use it? So even though you're a little bit older, if you're not going to use it, if there's a good chance you won't use it, but you can start collecting $1,700 a month or $1,500 a month or $1,200 a month or $2,000 a month, whatever your Social Security amount would be at 62 years old, why let $100,000 just go by the wayside to keep paying $500 a month, $300 a month for a group policy? Also, if you don't have insurance, when you collect your Social Security at 62, you absolutely can get insurance through the Obamacare program, through the ACA, the Affordable Care Act, which is what is called Obamacare. And if you only have, you know, Social Security coming in, you totally will have it subsidized and been paid for. I see something in the mail all the time from my friends. It's got to do with it's called the healthcare market. Everybody's on it that doesn't work, or even if you are working, you know what? You might not even be at a company at 62 years old that even offers health insurance. Maybe you just started and it's going to take 90 days or 60 days for it to even begin. There's all these different things. And so you can either get Obamacare and have your insurance and get your Social Security and spend a lot of it on insurance just so you're covered until you get to Medicare. You can get your Social Security and have nothing and take a chance until you're 65 and then you get it and you may not ever use that. And then of course I recommend getting the Advantage plan because that's free. Now you go from getting free money every month for the rest of your life that you started at 62 to when you become 65 and you get the Medicare Advantage plan like I've got, and then you have free insurance for the rest of your life. And when I say it like this, folks. I'm a person with a sense of humor. Okay, these are just my sayings. If you get the insurance at 65 that takes you back to when you were working and you're spending $300 to $500 a month for Medicare coverage by having a G plan or an N plan, just so you can say, you could go to any doctor in America and walk in the door. Well, first of all, you got to be sick. Second of all, why are you needing to go to Louisiana for a doctor when you live in Florida? You mean, oh, if you're visiting Louisiana? Well, if you're that sick, go into urgent care if you've got an Advantage plan like I've got. Or come back home if it's an emergency. You know, the Advantage plan is free. Why go backwards when you start getting your Medicare at 65 to paying $300 to $500? You might as well just keep working because you're just using all your Social Security money to pay for some insurance. Half of the Americans go for the Advantage plan, actually slightly more than half, and half go for the supplement plan. And the people that are paying that, they're just convinced, and they have the money, that they don't care if they lose $500 a month out of their Social Security to pay for some additional insurance. And another thing, I'll finish the video by saying, the Advantage plan that people want to disparage is you can only go to where you live. It doesn't travel well. You can't just go to any doctor in America. It's an HMO. Well, there's actually PPOs too in the Advantage plans. But what's the difference between the Advantage plan and all the years, the 30, 40 years you worked with a group policy where you had to go to your zip code, to your doctors, to your area? You weren't able to go anywhere. I mean, maybe there's certain government plans or certain insurance plans, I don't want to misspeak, that you could go nationwide. But most people that have a group policy at their job, it's going to be somewhere local to where they work and live. So it's just like the Advantage plan. So for me, I chose to get my money at 62, and I chose to collect over $100,000 by the time I reached 66 and 8 months, which is my full retirement age. It would take me until I'm 80 years old before I would ever start losing money. The average age of a male in America is only 73 years old. A lot of people never even reach 62 years old and they're taken home to be in heaven. And people that start collecting at 62 only collected for a couple of years. I know somebody recently that passed away. I know lots of people that pass away long before they reach full retirement age. Then what about those that wait to their full retirement age and now they don't want to do anything anymore? They got a little extra money, but they don't want to do anything. Their attitude has changed. Their insides have changed. There's something going on that's keeping them home. They got to see a doctor regularly and stuff. So live your life now. Don't worry about things that haven't come to pass. And 99% of the things that we ever worry about never come to pass. And there's always a way to make a payment to a doctor or a hospital if you had a major thing happen, that you can give them what you can afford. There's no such thing as debtor's prison, folks. But as far as I'm concerned on that insurance business, I would never for a second consider deferring my Social Security, my free check, my $100,000 that I'm going to collect by the time I'm 67 years old, that I would ever defer that just to get some insurance that costs me $6,000 a year that I might not even move. So on that note, folks, I would tell you, beginning today, nobody's promised tomorrow. Yesterday is gone. Today is the day that you need to crush it.